One morning, a 68-year-old man stepped out of his front door and simply vanished. He had only exhibited mild memory issues before that day, but when his family finally located him 6 weeks later, he was living on the street, exhibiting signs of severe self-neglect. This wasn't the expected progression of getting old. It was a physical degradation of the brain's circuitry so profound that his basic survival instincts had failed. To protect a patient's remaining independence and prevent this kind of collapse, physicians must identify the specific biological mechanism destroying the brain tissue. Medically, dementia is a broad umbrella term for a decline in cognitive function. It is not a single disease. Beneath this umbrella are distinct pathologies, most commonly Alzheimer's, vascular, Lewy body, and frontotemporal. Treating every case of cognitive decline as Alzheimer's is a clinical error. These conditions have entirely different biological drivers, meaning they require entirely different management strategies. The diagnostic process involves sifting through subtle physical and behavioral markers to isolate the specific type of brain damage at work. Reaching that specific diagnosis is the only way to turn an unpredictable medical crisis into a path that can be managed. The investigation begins by mapping external behaviors to their likely origin in the brain. With Alzheimer's disease, the earliest sign is typically a slow, insidious loss of episodic memory, specifically the ability to form and recall recent events. In contrast, vascular dementia often presents as a stepwise decline, where cognitive function drops suddenly following a stroke or a series of many strokes. Lewy body dementia presents highly specific markers, visual hallucinations, and violent physical movements during REM sleep. Frontotemporal dementia is unique because it often leaves memory intact at first, instead targeting personality, causing massive apathy or a loss of social inhibition. While these behaviors point toward a cause, confirmation requires looking directly at the brain's physical structure. Clinical cognitive tests help establish the severity of the decline, but neuroimaging provides the physical proof of the damage. Advanced neuroimaging techniques allow clinicians to document the physical architecture of the brain and identify where tissue is being lost. On this medial temporal atrophy scale, you see the physical hallmarks of Alzheimer's, shrinkage of the hippocampus, and widening dark voids where brain matter once existed. When we look past the organ to the cellular level, we find the microscopic causes of this tissue death. In Alzheimer's, beta amyloid proteins clump into plaques that choke neurons. In Lewy body, alpha-synuclein proteins build up in the cortex. These microscopic blockages are the physical engine of the disease. This physical evidence confirms that the patient's behavioral changes are the direct result of biological damage, not a failure of character or personality. These progressive diseases are currently incurable. Over time, the damage will inevitably impact activities of daily living, the basic tasks required to live independently. However, an accurate diagnosis allows for a targeted management plan that can measurably change a patient's quality of life. Medications like ACH inhibitors or mantinine are used to bolster the remaining cognitive function and slow the speed of the decline. This accuracy is vital because a Lewy body patient misdiagnosed with Alzheimer's can suffer life-threatening reactions to standard antipsychotic medications. Medical management is about strategically buying time, maintaining the patient's baseline functions for as long as the biology allows. Clinicians also must manage BPSD, behavioral and psychological symptoms of dementia, which include aggression and nighttime disorientation. One tool for this is the ABC assessment, looking at the antecedent, the behavior, and the consequence. By identifying what triggered a behavior, caregivers can address the root cause, such as hidden physical pain or sensory overload. This allows for non-pharmacological treatments, like adjusting lighting to fix sleep cycles or using music therapy to reduce agitation. The ABC assessment requires caregivers to step into the patient's distorted reality to understand their needs. This clinical tool transforms behavioral management into an act of adaptation and empathy. We cannot yet stop the biological progression of dementia, but through precise diagnosis and environmental adaptation, we can preserve the dignity and personhood of the patient until the very end.